Good morning everybody and welcome back to the UK Stroke Assembly live and in your homes. My name's Tony Banks, Head of Conference and Events at the Stroke Association, and I'm also really proud Chair of the UK Stroke Assembly. This is our final week of the first round programme that we've got for you as part of the UK Stroke Assembly virtual series. This week we focus on Every Stroke Matters. We've got a fantastic session lined up for you today, which we'll come on to in a moment. But first, there's plenty to catch up on. If you've missed any of the webinars so far, you can visit stroke.org.uk/UKSA virtual, and you can catch up on all the sessions we've had to date, including all the sessions last week around staying connected. As usual, we want to hear from you, so please do use the chat box to have your say and put your questions to today's speakers. And as always, we've got the wonderful Natalie with us to take your questions and comments. Good morning, Natalie.
Good morning, everyone, and welcome to today's session. As always, if you do have any comments and questions that you would like to share, please do use our chat box. You'll be able to find this on the right-hand side of your screen, and if you scroll down to the bottom, you'll be able to enter your text and questions into the text bar and submit those using the arrow key. I look forward to reading those.
Thanks, Natalie. If you're using social media, please use the hashtag Stroke Assembly. If you're using Twitter, Facebook, Instagram, please do post and share everything you can around today's session. And we want to hear from you. Your feedback's really, really important. We are going to be returning after the summer for another round of Stroke Assembly webinars in September, launching on the 2nd of September. And before then, we want to hear what you'd like to hear more of, what's worked well for you, and what maybe we could do anything more for you in the future. So tell us your feedback. We'll post a link in the chat box in a moment. On to today's session. So today's a really exciting session for us. We've got some great guests with us, and the name of the session is What Does Coronavirus Mean for Stroke Services? We're joined by Juliet, who returns, the CEO of the Stroke Association. And Juliet's going to be chatting to Dr Deb Lowe, National Clinical Director for Stroke Medicine, and Dr David Hargroves, National Clinical Lead for the Getting It Right First Time programme. We're really pleased to have them here today. So do put your questions in the chat box to them and ask anything you'd like to know about stroke services and the future of stroke services. But for now, I'll introduce Juliet, and she'll do the introduction to the session, and then she'll bring on Deb and David for the Q&A. Look forward to seeing you later, and over to you, Juliet.
Great, thank you, Tony, and good morning, everybody. Good morning to the virtual UK Stroke Assembly. I do hope you're enjoying it. Been watching our weeks progress, and it looks like you're having a lot of fun, so it's really nice to be back. So what I'm going to do is just give you a brief update on how the Stroke Association has been responding to the coronavirus pandemic, and then I'm going to facilitate a little chat with Deb and David so they can talk to us more widely about how the NHS has been playing its part to support people affected by stroke. So, what's the Stroke Association been doing over the last few months? Well, as you can imagine, we've been busy. One of the first things that we noticed when the coronavirus pandemic really started to escalate from about the middle of March onwards is we started to see a dramatic reduction in people presenting at hospital in emergency departments. Emergency department admissions reduced by around 50% across the UK, and we also saw a dramatic reduction in people presenting at hospital with stroke symptoms, and clearly that was a worry to us. So very quickly, in partnership with stroke clinicians across the UK, launched a campaign to promote the fact that stroke is a medical emergency. And we promoted the importance of people acting fast, and if they saw any one of the 4 symptoms of stroke, to call 999. And we also were very clear that actually people would be assessed in a safe way, and the stroke units were open for business and were safe and effective. And I'm really pleased to say that that campaign has been sustained. You will have noticed the NHS has kind of taken up the messages. They were even mentioned in some of the Prime Minister's daily briefings by Steve Powis, NHS England's medical director. I'm pleased to report that stroke admissions are now getting back to near normal levels. Our stroke clinicians and hospitals are doing an amazing job keeping up the really high standards of treatment care that stroke survivors were experiencing pre-COVID. And I'm sure that David and Deb will say more about that shortly. The Stroke Association has also had to massively adapt its own services. Because from March, we asked all of our staff to work home, and that meant that all of our face-to-face support that was provided through our local stroke coordinators and our local clubs and groups had to change, and it immediately was provided online or by phone. And I have to pay tribute to all of our coordinators and our volunteers in the stroke clubs and groups, because they've been doing an amazing job adapting to provide much needed telephone and digital support. And it's quite amazing what's been going on. We had a webinar a few weeks ago where we showcased some of the fun stuff that's been going on in our stroke clubs and groups, where people are using WhatsApp, FaceTime, Zoom, other social media platforms to have meeting coffee mornings, are continuing to do sing-alongs, and our stroke coordinators are just as much in touch with our beneficiaries as before, but clearly not able to support people face to face. We've also expanded some of our existing services. So we've increased capacity on the stroke helpline, which is there for people affected by stroke across the UK, Monday to Friday and Saturday mornings. We've expanded the financial grants that we provide, because we know that people are experiencing additional costs associated with their stroke. We've created whole new pages on our website. Now, those website pages give fantastic information about stroke and coronavirus, how you can support your mental health and emotional well-being during these difficult times, and how to stay physically active. And we've got some lovely videos online in partnership with Little Learning that just provide some really simple tips and advice on how you can do chair-related movements and just really simple physical activity. You're standing up, and we know that all of these exercises are safe for stroke survivors. We've also a guide for people with aphasia in terms of how to get online. We know that one of the downsides of providing remote support is that people with aphasia are really struggling and feeling excluded because they don't experience the ability to lip read and the kind of language and cues that come from a face-to-face conversation. So we've provided a really useful guide for people with aphasia for how to get online, and another guide for how to do video calling. So they're just some examples of how we've adapted our existing services. And finally, we've also developed 2 brand new services, both of which went live in April, and both of which are available to stroke survivors and their carers all across the UK. So the first of those services is a service called Stroke Connect. Now, in England, we're very fortunate. It is funded by NHSE&I, but it's available in Scotland, Wales, and Ireland. We've also had external funding. And what we are offering is that when people are newly discharged from hospital, at that point in their lives when they're feeling particularly frightened, anxious, concerned about what their recovery might look like, we're offering phone calls to provide information, support about available services, and advice on how people can rebuild their lives after stroke. And I'm really pleased to say that we've now got 57 NHS teams registered. As of today, we've received 710 referrals, but we would like even more referrals. It's a really great service, both for people affected by stroke, but it can also relieve capacity on the NHS. So please do let people know about that service. And then finally, our second brand new service is a volunteer-led service called Here For You. And that's a service that we've launched to try and combat some of the social isolation that stroke survivors are experiencing during coronavirus. And we now have 625 referrals and over 350 volunteers who are trained and are now providing both peer support and companionship to people at home through weekly phone calls for up to 12 weeks. Again, it's a great service, and we would absolutely love it if people either sign up to the service if they think they would benefit from it, or would volunteer for us. Those are just some examples of how we've responded over the last few months. I'd just like to say thank you to everyone on this call for your support, because I'm sure there are people on this call who are actively part of those new services. So I'm going to move on now, and I'm going to invite Deb Lowe and Juliet to join me in conversation. As Tony said, they're both stroke consultants, very respected, and both of them have really important roles with NHS England and NHS Improvement to spearhead innovation and improvement across stroke treatment and care. So welcome, David and Deb. It's nice to chat.
Good morning.
Good morning, Juliet.
Great. So maybe I can start with you, Deb. I wondered if you could just tell us what's happened over the last 4 months and how the NHS in England has stepped up to support people affected by stroke.
Thanks, Juliet. Morning, everybody. It'd be lovely if we could see you, but obviously not this year. So it's been an extraordinary 4-month period, really. I have been astonished and, well, not amazed, because I know how amazing the NHS is, but staff have stepped up to cope with what's been the most challenging period, certainly in my lifetime, and I think everyone else's, dealing with the pandemic. It's been a difficult period. I think the first few months with the initial surge obviously put huge demands on hospital services. But what was very clear is that all of the acute services that we need to be delivering for urgent and acute care, like obviously stroke, heart attack, sepsis, all of those continued, and the NHS has remained open for business as usual throughout the last 4 months. And that's really important. I suppose that I remind everyone of that certainly in England, acute stroke services in all hospitals that have hyperacute stroke units has continued. TIA services have continued as well. But it's a bit of a different experience when you come into hospital, because obviously people are wearing face masks to protect you, and often aprons and gloves. You'll often have to have a swab when you first come into hospital. And now we've got much more rapid testing, so we know whether someone's been exposed to COVID or not when they come in, and we can provide safe care for you and for the people. The rehabilitation services, obviously community rehabilitation, that we try and deliver to enable people to be discharged really, really quickly after your stroke. A lot of that has been done virtually. So we've had tele-rehabilitation, which we're really excited in the future to look at evaluating further, because that's been a very beneficial pathway that's been delivered and developed. We are aware, however, that stroke survivors have been much more isolated, and I think one of the really unpleasant bits of the last 4 months, other than wearing PPE all day, which is quite relatively unpleasant, is not being able to see carers and relatives in the same way, because as you'll know, most NHS hospitals haven't been able to allow that. So I think that's one of been the biggest challenges, but many hospitals have done lovely innovation to make sure that you can do FaceTime and apps to make sure that we can connect, but it's not the same as being by your loved one's bedside. So I think that's been one of the big challenges and changes over the last 4 months.
Yeah, I mean, I know it's really tough for you guys working in the NHS, but I've just been so impressed by the incredible kind of commitment, passion and teamwork that our kind of stroke teams have shown all across the UK. I mean, I think it's just testament to how kind of patient focused you are, and how you every day are working tirelessly to do the right thing for stroke survivors. So Deb, I kind of mentioned in my introduction that the Stroke Association and NHS England have been working even more closely together over the last 4 months. So do you want to say a little bit about how that relationship feels from your perspective?
Yes, I mean, certainly, for those that don't know, I'm relatively new into the post as National Clinical Director, so I took over from Professor Tony Rudd at the beginning of the year, so it's been a bit of a baptism of fire. But it was very clear that we're much stronger as an organisation within NHS England if we're working really, really closely with our patient and public voice and our voluntary sector. And obviously our main charity within the National Stroke Programme is the Stroke Association. So I've had the privilege of chairing the National Stroke Delivery Board with Juliet. And obviously the last 2 meetings have been virtual, which is a chair challenge. But we co-chair the meetings. We've been very clear that we didn't want to lose momentum with the National Stroke Programme. So stroke is part of the long-term plan. And Juliet and I and David, who is an integral part of the board, we have been really clear to learn from what we've experienced during the COVID period, because there's been huge accelerations in innovation, but learn from that and repurpose some of our priorities. And we've been really clear that our top 3 priorities remain developing integrated stroke delivery networks, which are essential for us to be able to have bespoke stroke pathways across the country, but also ensuring that our rehabilitation and life after stroke pathways are really our main priority, along with improving access to thrombectomy, because it's such an effective intervention. The other really exciting bit of work, as Juliet mentioned earlier, is Stroke Connect. So this is initially a pilot with really supported by NHS England. And we know that about 40% of the country don't have commissioned stroke association services. And we know the gap that has led to, certainly David and I, from doing the GIRFT visits, where we went around the country and visited every single stroke service. There were many services that didn't have voluntary sector support when people left hospital, which felt during this COVID period to be a much bigger problem, because people were feeling much more isolated and much more alone. So the Stroke Association connector for this new service calls the stroke survivor or relative really quickly after discharge from hospital to provide assurance and support and reconnect with the hospital if actually there are some really worrying things that the stroke connector on their own can't support. So I think that link between the acute hospital is really, really important. And then a further follow-up call is offered about a month after. We've been getting some really good feedback. We're really keen to evaluate the service to see if it's something that going forward we can look to roll out on a more permanent basis. But it's really exciting, Juliet. We're really pleased to be working so closely with the Stroke Association.
Well, ditto. It feels really exciting and potentially a new additional service to support people to rebuild their lives after stroke. So, as you say, we look forward to seeing the full results of the evaluation and working out what next. Yes. So I'm going to turn to you, if that's all right, David. So Deb sort of touched on this about some of the amazing things that have been kind of pioneered, kind of trialed over the last 4 months. So can you share some of the success stories that you've personally witnessed?
So thanks, Juliet and Deb, and good morning, everybody. It's a real pleasure to be here speaking with you. So there's no doubt that the COVID pandemic has put a huge challenge to all of you and to us working in health and social care. But as Deb and Juliet have alluded to, that sometimes during a crisis, we do see great innovation. And the great news is that the quality of care that we've seen for stroke survivors on the 108 stroke units in England has not been impaired. And I think that's the first thing to say, is that the preliminary data we've got shows that more patients have been getting to stroke units quickly within 4 hours than previously, the previous years before. More patients are getting their brain scans quickly. We're being able to intervene with some of the other multidisciplinary aspects of care much quicker than we ever have before. And so despite the COVID pandemic, I think it's great news for stroke survivors and their relatives to know that the quality of care hasn't been impaired at all, which is really great news. We have had to do things differently, and one of the really exciting innovations has been the adoption of virtual communication. So as we are today, talking from different parts of the country to each other and understanding, so we've been able to do that with patients. So reducing the likelihood of patients having to come into hospital. We've been able to do the vast majority of our clinic appointments either via telephone or through a video link if patients are keen for that. We've also seen that video technology being rolled out in parts of the country to the ambulance service. So there are several pilots underway now where the paramedic communicates via a video link to the stroke specialist in the stroke centre, and that stroke specialist is able to speak to the patient, their relatives, examine them virtually, and then make a decision with the patient and the paramedic as to what the correct treatment and course of action will be. And the preliminary results suggest that between 40 and 50% of patients have an alternative outcome as a result of that consultation. So maybe it wasn't a stroke, and in fact it was something that could be managed by simple advice or with their GP, or in fact it was another condition that mimicked a stroke and they'd be better off cared for by a local hospital. So that's really exciting, and again some of the preliminary results suggest that the patients think it's of great value, and primarily because it potentially reduces them having to come to hospital at all. There are other innovations we've seen. So brain scanning is really important when we're caring for patients that have suffered a stroke, and we've been able to look at ways of supporting the clinicians caring for these patients, interpreting brain scans. And we've got several regions in the country now that use complex software to share the images, which helps speed up the diagnosis, but also share those images with other centres that may well be performing some of the interventions, this clot removal treatment, thrombectomy, which again has great benefit, we think, for everybody. The other thing to say really is that the sharing of knowledge and the coming together of both stroke survivors, the Stroke Association, and all the clinicians up and down the country that care for patients with stroke really has been amazing. And I'm pretty chuffed to work in stroke medicine, and I was before, but now we've built up so many more sharing relationships with regards to knowledge, understanding how we can support each other, and this has the benefit of improved outcomes for our patients. Before, we might have had silos of great working in one part of the country that took months, if not years, to get into academic print before somewhere on the other end of the country knew about it. Whereas now we almost weekly, and if not fortnightly, have these conversations virtually, and great innovation is shared almost immediately. So there has been some positive that's come through this pandemic, and I think the great news for everyone on this webinar is that stroke survivors have got as good a chance of great care in the English stroke service than they ever have, which is really, really positive.
So David, that's just massively encouraging to hear, and I'm sure a really positive message for the virtual UK Stroke Assembly. So thank you. So just briefly before we open up to questions, what does the next months look like for stroke services?
So what's really important is that together we lock in some of those innovative changes in behaviour so that we don't lose some of the great new models of working. Part of the long-term plan for the NHS was to look at different ways of working, and so we're going to make sure that all of our stroke services really assess what they've been doing differently and ensure the things that have been working we continue. We don't want to go back to old ways of working if in fact the new ways of working during the pandemic were of great benefit to patients. So we're going to ensure that happens. We know that unfortunately COVID isn't going away for the next 12 to 18 months, and therefore the infection control measures that we need to ensure are still in place over the next 12 to 18 months. So for anyone that does require attendance at hospital. We will still be asking people to wear masks, and there will still be virtual working wherever possible. So this is to protect patients predominantly, but also patients may actually find it of benefit not coming to hospital and having to queue up and park and those sort of things. We will make sure that some of the integrated stroke delivery networks, these new 22 areas of the country which will have some support to develop stroke services, do actually start to take form and start to deliver across the entirety of the pathway, so prevention right the way through to life after stroke. And so it's a really exciting time over the next 12 months, but we have to be mindful that unfortunately the virus isn't going away, and therefore things will be a bit different for some time. But I'm confident, and I know Deb is, that we have an amazing workforce in the NHS, not just in stroke, but within the NHS. And we're here to help everybody, to listen to you, but most importantly, care for you. And I'm confident you're going to get some great care if you need it within the NHS.
Great. So some really positive messages there from both Deb and David. Thank you very much. So I'm going to hand back to Tony now, because I suspect, or I hope, there may be questions from the audience.
Thanks, Deb, David, Juliet. Some really great stuff to listen to there. And we have had some great questions, which we'll get to in just a moment. But first, a quick question from me to you, Juliet, if you don't mind. It's been great to hear about the response in England, the Stroke Association being a UK-wide charity. I think it would be nice to hear about our response in Northern Ireland, Scotland and Wales, if you wouldn't mind briefly talking about that.
Yep. So, I mean, we've been working very closely with Deb and David's equivalents in Scotland, Wales and Northern. So the partnership in those countries is equally close. In Northern Ireland, we have a particularly close collaboration with a sister charity, Chest, Heart, Stroke Northern Ireland. And during this COVID period, we've launched a joint stroke pathway with them, which is really exciting. But we are concerned that the reconfiguration of stroke services in Northern Ireland is on hold because the Northern Ireland Assembly is not operating effectively. So we are putting pressure on the Department of Health and politicians in Northern Ireland to get that reconfiguration of acute stroke services back onto the agenda. In Wales, we're also lobbying to make sure that there is an updated national stroke delivery plan in Wales. And the Stroke Association is convening a community of best practice in Wales to try and make sure that some of the innovation in one part of Wales is shared with other parts of Wales, and also that we learn from NHS colleagues in other parts of the UK. And then in Scotland, again, we work with Chest, Heart, Stroke Scotland on the programme for change with the Scottish Government, and Stroke Connect and Here For You are also available too. So it's very much a kind of UK effort. Thanks,
Juliet. We're going to bring Natalie back on, who has been looking at the questions and comments from you. Just before we get to those, apologies if anybody watching has had some sound difficulties when Juliet's been speaking. We're sorry about that, but we'll get to questions and comments now. Natalie, what have we had?
Hi everyone again, and thank you to everyone who has shared their comments and questions today. It's been lovely to read those. We'll start off. I've got a question for you, Juliet, if that's okay. You mentioned at the beginning of the webinar around some of the services that we've put in place as an organisation to support people throughout the pandemic. I've got a question here, and it's around, are these services likely to continue beyond the pandemic at the moment?
So that's a really interesting question, and we actually have a conversation about exactly that scheduled for our next Executive Directors Team meeting in August. Stroke Connect is a pilot, and as Deb said, we do want to evaluate it to see what's working, what's working in that service. For you, is something that I think we already know we would like to sustain. Volunteer-led services do require quite a lot of management and coordination, and we want to make sure that our volunteers are appropriately trained and feel supported. But we've been overwhelmed actually with the number of people who want to volunteer, both stroke survivors and others who've got a commitment to the Stroke Association. And we're hearing wonderful stories, only from the benefits, but also from the volunteers about just how rewarding and fulfilling it is, and what an easy way it is to make a tangible difference to somebody's life. And although the service is only for 12 weeks, we're already hearing stories of volunteers forming friendships with the person that they're matched with, and that kind of conversation and friendship carrying on with the Stroke Association support. So it's really lovely. So we'd really like to expand that.
Thank you, Juliet. And I'll just share a few comments around people who have been using our services already. So Janet shares that I'm a Here For You volunteer, and one of the people I'm speaking to has had all her rehab virtually, and she reports it's working really well. And Nick also shares that he's been taking part in our telephone support service for 6 weeks and finds it excellent. So that's really nice comments to hear that people are benefiting from the services that we've already got in place. I'll just pop one more question if that's okay. And that's for you, Deb. It's around the tele-rehabilitation that you mentioned. Do you have an idea of when this will be evaluated?
So we'll be doing it concurrently, really, as it continues over the next 12 to 18 months. So in some regions already, the rehabilitation teams have been really proactive and have looked at evaluation models, but also as part of our priority in the long-term plan to looking at rehabilitation and the NHS overall view that we need to evaluate some of these really high impact services. There's going to be evaluation as part of the long-term plan rehabilitation workstream that's been led by Rebecca Fisher. The other element where we're hoping to pick it up is rehabilitation pilots that are one of our priorities within the long-term plan. And we are just getting ready to hopefully go live with our first phase of pilots that looks at higher intensity home delivered rehabilitation. And the second phase will be having a real focus on virtual rehab.
Thank you. We've had lots of comments and questions today, and apologies we've not got round to answering all those. But thank you. I will make a note of these and we'll pass on to Deb and David afterwards, and hopefully we'll be able to get more answers for you. So thank you everyone for sharing today.
Huge thank you to all of you that have posted questions and comments. It's been a fantastic session. Deb, David, Juliet, it's been great to have you at the Stroke Assembly. Hopefully see you again soon at the Stroke Assembly, but for now, thanks again.
Great, thank you.
Great, thank
Wonderful.
you. Bye everyone, take
Bye-bye,
care.
everyone.
Bye.
Bye-bye.
I'm afraid that's all we've got time for today's session. We will be back for one final session of this programme on Friday at 11 AM, where we'll be talking about how to manage your emotions and tips and techniques for doing that. So join us at 11 on Friday. Please do give us your feedback. We'd love to hear it. We'll post the feedback link once more time before we finish. Hope you've enjoyed today, but for now, thanks, and we'll see you again soon. Bye-bye.